An apple a day keeps the doctor away. But what if public health education can address community health outcomes and disparities? Welcome to Symptoms to Stories, where we address the disconnect between confusing technical health information and the accessibility of local community resources in Tulsa, Oklahoma. In today's episode, we will take a look at medical translation and its role in healthcare. Enjoy!
What is your name and occupation, and how did you get where you are today?
Hi, my name is Marisela Ramirez. I am a Spanish medical interpreter. And like anything, you get to where you are by being practicing and involving yourself in things that relate to what you want to do.
And what are the translation options at St. Francis? And if you know, how does that compare to the rest of our community or state?
That I know of, it would be our group as interpreters. It's 7 of us, women. We have the Marty, which is a video program that also does several languages, and language line over the phone. I don't know how it would compare to other communities because I don't know what they do, but as far as the hospital goes, it's just those 3.
Thank you. And what inspired you to become a medical interpreter? And was there a specific moment where you knew this is like what you wanted to do?
Yes, I was inspired to become a medical interpreter in my late 20s. My friend got diagnosed with breast cancer. She didn't speak any English, only Spanish, so I started going with her to all of her appointments and surgeries. I saw the need and how important it was for patients to understand everything that was being said to them and to be able to communicate back. She didn't make it, but that made me realize that the need for interpreters at the time was at that time I was working as an interpreter for the Miami School District. I worked there for several years, but then I saw the opportunity to work for the hospital, and I took it. I very thankful that this opportunity was given to me.
Wow. What is the main language you interpret, and what kind of patient populations do you most often work with at St. Francis?
Well, the only language I interpret for is Spanish, and we mainly interpret here for triage, labor and delivery, postpartum, antepartum, the gene patients, lactation. We do birth certificates because that also is important. We have to make sure that they put all the correct information. But we also interpret for NICU and St. Jude, which it deals with cancer with children.
Mm-hmm. How does miscommunication due to language barriers impact patient outcomes or trust within the healthcare system? And is this common within our community and among what populations?
Well, the impact is huge in every way, because if there's no interpreters or my interpretation is incorrect, a doctor could misdiagnose a patient or instructions on how to take medication or administer medications. That can be harmful or even fatal for patients.
And can you share a moment where your role as an interpreter made a critical difference in a patient's life or career or care? How did that moment affect you as the one interpreting?
Yes, a couple years ago we had a Spanish-speaking patient that had just delivered. She was trying to tell the nurse that she felt her arm felt numb and her leg felt weird or heavy. So the nurse calls me, and I go to the room, and I was interpreting for the patient. It turns out she was having a stroke, and then all of a sudden everybody started running. We took her to the ICU. She was there for a few weeks, and after that she had physical therapy and made a full recovery, and was discharged a couple days after that. It just I know that if she didn't have a way to communicate to her nurse what was going on, that would have had a very different outcome.
Yeah. So what are the biggest challenges you face as an interpreter in a hospital setting, and how do you work to overcome them?
So the biggest challenge for me as an interpreter is when I get a call to interpret and the doctor or the nurse doesn't know how to utilize my service. They say big phrases or mix everything together with questions, suggestions, and don't allow time for me to interpret. And that is very frustrating for me because the most important thing for me as an interpreter is to make sure that the patient or the patient's parents understand all the information given. And the way I deal with that would be I usually just ask the doctor or the nurse, please speak in shorter sentences and please allow me time to interpret.
Do you feel you are adequately recognized as part of the healthcare team? Why or why not?
Most of the time, I do feel adequately recognized as part of the health team. Other doctors, most of the doctors call to interpret when they have a patient with us. And most of the nurses too. Once in a while, I encounter a nurse that thinks that playing charades with the patient is funny or thinks that it's okay. And sometimes I encounter nurses that think that speaking loud to a patient is going to automatically make them understand the English language. So, some nurses don't even think that is necessary to call an interpreter. So what I say to them is this: put yourself in their shoes. You're in a foreign country. Something happens to you over there. You're in a hospital. Your nurse comes in. She says something to you that you completely don't understand and injects something in your IV. How would you feel? So some understand and some don't, but I at least try to help them understand.
That's a really good point. In your opinion, what are the long-term consequences for communities that lack access to proper medical interpretation services, and what are some possible solutions to solve this problem?
Well, the communication with the patients will be negatively affected. Long-term consequences of not having a professional interpreter could be, again, a misdiagnosis or parents using their children. I have seen that a lot, where a lot of Hispanic families use younger children as interpreters. And so we need to provide professional or in-person interpreters to help with that.
And do you face any challenges not knowing the specific medical terms you're translating, and how do you face those challenges?
Yes, I do face challenges when I don't know the medical term, but I usually ask the doctor to please explain what the word is, and instead of interpreting the term, I explain it to the patient. So there's also cultural differences within the same language. For example, a word or a phrase in Spanish may mean one thing in one country. For example, Mexico, Venezuela, Brazil, and other countries that speak Spanish. And it's the same for us, but it means a different thing for them. So I usually ask the patient, when I see their face confused, I ask them, are you okay? Does this mean the same to you than it does to me? And so I clarify most of the time.
Okay. Were you working as an interpreter at the time of the pandemic? And if so, how did you work through those emergencies, and was there anything unique to our community?
Yes, I was working during the pandemic. I think we had the same procedures as anyone else in the country. No visitors. It was very limited. But I guess we all did what we could. It was a horrible time for everybody.
And if hospitals or public health systems invested more in language access services, what improvements do you think we'd be able to see in public health outcomes?
I think if hospitals or public health systems invested more in language access services, we would be able to see patients that are more confident in being able to communicate with health professionals and trust that they will get appropriate care and understanding. I just feel like it's necessary.
And how do interpreters help mitigate systemic inequalities in healthcare access for immigrant and non-English speaking populations, specifically in our Tulsa community?
I think making sure they are aware of what they have available so they can have the resources needed. It involves shifting from individual actions to changing the policies and practices, power structures in institutions like legal systems, economy, and education to ensure more equitable opportunities or access to resources for everyone.
And how does medical interpreting connect to a bigger public health issues like vaccination, prenatal care, or mental health?
We do provide information for all our patients that we have available for Spanish-speaking patients and families. And we do provide information on how they can obtain like mental health or vaccines or other helps and resources at other places.
And then finally, what is your favorite part of your job, and in which areas do you find it to be the most fulfilling?
Well, my favorite part of being an interpreter is helping people and knowing that at the end of the day, I made a difference. Every interpretation session is fulfilling for me. I enjoy what I do wholeheartedly. And once in a while, I think of my friend that passed away many years ago, and I appreciate the fact that was being a long journey for me. Thank you. Sorry.
Thank you so much.
Oh, that was so sweet.
Thank you, girls.
so much.
Thank you.
I'll give you. Oh, thank you.
Wow.
You're welcome.
It's amazing. Okay, perfect.
Thank you for joining us. I hope all of you watching enjoyed today's episode as we bring the public back into public health. Thank you.